Think of a time when you were a patient in the hospital. Maybe you were treated for a sudden infection, or you needed to have surgery. Maybe you went to give birth to your child. Now think about the moment that you left, walked out the doors, saw the hospital building shrink in the distance, got to your block, made it home. You probably started to think about what you needed to do for yourself. Maybe you called your doctor to schedule a follow-up appointment, or you had a friend pick up your prescriptions. Your home care nurse came to change your surgical dressing, and you ordered some groceries on Instacart. You were probably very uncomfortable, but let's assume you had everything that you needed, and anything you didn't wasn't out of your reach. Now think about this same care transition without a home to go to. No friends or resources to support your recovery. It's easy, isn't it, when we leave the hospital to look at our discharge instructions that we receive, and they assume that we have a car to drive ourselves to appointments and a phone to call for help, not to mention a home. These instructions are meaningless for a growing number of our neighbors across our country and in Buffalo, New York, which we call the city of good neighbors. Neighbors who have lost their homes for a number of reasons, but many while hospitalized. Doctors and nurses send them on their way with a discharge instruction packet that lists a new diagnosis, homelessness. And with it, the extreme burden of dealing with medical needs and social needs in the face of insecurity. This is the story of Jesse, a Buffalonian, who struggled for years with mental illness and substance use that wore down his ability to take care of himself and live well. A wound on his leg that was chronic became infected, and he ended up in the hospital. His stay was long and complicated, and during his inpatient admission, he lost his home. He had nowhere to go when hospital care was no longer needed. This is when I met Jesse. As one of 4 registered nurses, as a part of the Clinical Scholars Fellowship that helped to launch a project in Buffalo called the Buffalo City Mission Recuperative Care Collaborative. Through a unique partnership with the University at Buffalo School of Nursing, this project linked health and social organizations together to deliver a new kind of care for Buffalonians like Jesse, medical respite care. Medical respite care is a type of care that gives safe shelter, help for medical coordination and medical needs, and also support and case management for social needs like housing and income. To be fair, we were not always collaborative. Before this project began, it was almost like we didn't know who was in our own neighborhood. Shelter workers often struggled to get in touch with people in the hospital, and hospital providers really didn't make time for relationships with people in the community where they were sending their patients, even though we worked mere blocks from each other. So patients like Jesse often languished in the hospital for months, waiting for placement. And when they were sent to shelters, they were often unfit for their care needs, so things like wound care and medication management were left for them. If they did come to the shelter with anything missing from their hospital stay or discharge instructions, they were often sent right back to the emergency department. These simple issues could have been solved by shelter workers had they known who in the hospital to call, especially after hours. So when hospital providers downgraded Jesse to a level of care that was meant for patients who didn't have anywhere to go, but really didn't need to be in the hospital anymore, he felt this disconnect. He wasn't getting answers from his medical team about his medical needs, and he had no clue if there was a place for him in the community or if anyone was trying to get him there. Unsurprisingly, this made him feel very disempowered and feel really alone and afraid for his future. And this wasn't putting him on a path for healing. And we were also noticing that this was happening to a lot of patients in his situation. So when the Buffalo City Mission, our area's largest homeless service provider, decided to build a 13-bed medical respite unit in their new men's shelter, we decided it was an important time to get to know each other, to see who was in our neighborhood, also thinking that care for patients like Jesse just had to get better. Together, we created Buffalo's first medical respite program because we all agreed that no neighbor of ours should or could possibly recover in the face of acute medical diagnoses without safe shelter and support. Our team and our program runs on relationships that we built to bridge different types of care so that each kind of collaborating partner is available for our patients at each different stage of their care transition, from referral in the hospital to 30 days after hospital discharge. Even our inpatient providers and partners are committed to collaboration on patients long after they've left their buildings, and this is really rare. So when Tracy and Helene, discharge managers in our hospital partner, Erie County Medical Center, called us to talk about Jesse's story, we spoke from shared goals. First, we wanted our clinical intake nurse to review his case to see if he was eligible. And then we sent Tamika, our shelter supervisor, to go talk to him and see if he wanted to come to our unit to receive support for his medical needs and also help with his social issues, housing and income. It took a long time, a lot of weeks, a lot of creative thinking, collaboration, but we finally achieved the care transition that we were all hoping for, I think including Jesse. He got out of the hospital, and we welcomed him into our respite unit at the Buffalo City Mission. We know that the first days after hospital discharge are incredibly risky for patients like Jesse who have both medical and social needs. So we very quickly linked him with a long-term medical home for his primary care needs at the Jericho Road Community Health Center downstairs from our unit. And knowing his mental health history and also his very tenuous transition to us, our project social worker would just stop by with her coffee in the morning on her way to her office down the hall to chat until he was ready to work together and get therapy. And most importantly, Buffalo City Mission case managers like Horace, they wrapped around Jesse 24 hours a day, 7 days a week to do the things that we often don't even think about or have time for in healthcare. Help him find IDs he missed, lost in his admission. Do the paperwork for his social security and his disability payments. And to help him start to talk about home and what that looked like and how to get there. In our team's weekly case conference meeting, which is our grounding meeting, we all celebrated to see Jesse stable and thriving, linked with the organizations that he needed for his individual care transition, and pushing past those critical days, 7 days after hospital discharge, then 14, and then 30 without issue. His medical needs were still a facet of his care, but they were shrinking, like the hospital building in the distance. And eventually Jesse went home to a place of his own, but he didn't go alone this time. He went with support from our partners in the Visiting Nursing Association of Western New York, who followed him there to continue their work with his mental illness needs, his wound care, and his physical therapy. Long after Jesse left our program, his story lingered with us and with members of our team. It helped us to see what was possible when we stopped working in the shadows of each other. And we started from the sunny spot of collaboration. Shifting Jesse's trajectory, his story, required us to create relationships that didn't exist, to give the exact kind of care that he needed that also didn't exist, medical respite care in our community. The only program of its kind in the 250-mile radius of our city. And we're happy that our relationships have grown, and so has our program. And 200 men in similar situations to Jesse have moved through it, from hospital discharge, many to homes of their own. Medical respite care is a model that's growing in frequency in our country, but it's small compared to this huge crisis that we're seeing of homelessness. We know that the discharge to homelessness or to the streets is incredibly unsafe, but we also know that if medical respite remains a small facet of care or an exception in the face of this rising crisis, this kind of discharge will become the norm. In order to ensure that every neighbor of ours has a chance at healing after acute hospitalization, we need a number of things. First, we need legislation that clearly supports medical respite as a standard practice. In Buffalo, we've started meeting with New York State leaders to ensure that medical respite becomes a billable standard in our Medicaid program. We need leadership and funding that facilitates and sustains cross-sector collaboration. Leaders in our area have allowed their staff to collaborate on patients in our program long after they've left their censuses. This is incredibly valuable and has helped us to achieve outcomes like increased continuity with primary care relationships in our patients. But it's incredibly costly and hard to sustain. And to do that, we need research that proves the value of building relationships across sectors of care. We forget or don't think about people in the community who take care of our patients after they leave our conventional settings. But we need to stop that, and we need to prioritize research that shows the linkages that allow for patients like Jessie to heal when health and social organizations are integrated. These things are not easy, and they will take more time, but we're used to that coming from the city of good neighbors. Our shared commitment to patients like Jessie is pushed forward by this new knowledge that collaboration is the only way to serve patients like him. And our commitment and belief that none of our neighbors, all of our neighbors, deserve a safe home to go to, help with their scary medical issues, and a real chance to focus on healing, an equitable chance. And ultimately, our commitment so that no neighbor of ours leaves the hospital with a new diagnosis of homelessness on their discharge instructions.